Today in the studio, we have a real treat. He's a world-renowned, board-certified plastic surgeon with 2 offices in New Jersey and 1 in Manhattan. He's been featured in Vanity Fair and has also been awarded NJ Top Doc for the last 10 years. He's a car enthusiast, a car collector, and a wine connoisseur. He's a father, a husband, and a great son. Dr. Joseph Racanelli.
Hi, Joe.
Hey, how you doing?
How are you? Thanks for coming in.
Thanks for inviting me.
Joe, the reason why we wanted to do this is because the younger people always push me to get on social media and have podcasts. And, you know, I did it kicking and screaming, but then I realized that this is a great platform to be able to introduce people to my clients and to all our listeners. And because I do refer clients to see you all the time, I thought it was important for you to come in and people can get to know you. Because I think making an appointment with a plastic surgeon is kind of intimidating. And anyone who I've ever sent to you has always come back and said how kind you are, your office staff, and they love you. They really and truly do.
That's fantastic.
I've never heard one bad thing.
That's fantastic.
So I thought it was important for everybody to get to know you.
I'm happy to be here.
Yeah,
and
thank you.
I appreciate the referrals.
Thank you.
And personal experience as well, too.
Absolutely personal
We could get into that in a little bit.
Yes. Yeah, no, you're unbelievable. But my first question to you is, has the age changed for women for plastic surgery?
I think in context of social media, I definitely think that younger people are more interested in plastic surgery now than I think they've been in, like, let's say, the 70s or 80s.
Right.
You know, historically, people would think it was just really for older people or for people, you know, very wealthy people. Mm-hmm. But I think things have changed dramatically. I think a lot of, you know, plastic surgery is affordable for pretty much anyone. You know, and pretty much the younger people are more concerned with the way they look, especially with social media and filters and the quality of the photography.
Right.
And also there's a lot of, you know, celebrities that really, years ago, they would hide their plastic surgery. And in this day and age, people celebrate it. So they know that the Kardashians got X, Y, and Z done. And then the younger generation does have some interest in doing that, especially with the non-invasive things, the lip fillers and things like that. And then I think breast implants are, you know, probably very, you know, at an all-time high, if you will. So people, you know, see that, you know, there's things that they can change. And I don't think it has the stigma that it might have had years ago.
Right. Younger and older. I see a lot of older women getting breast implants.
Sure.
That, you know, you would never expect.
Sure.
Like in the late 50s,
Absolutely.
right? Am I right? Early 60s?
Look, you know, I've seen patients get, you know, tummy tucks in their, you know, late 70s, you know, almost.
Really?
Yeah, absolutely. And I asked, I said, why now? And the woman said, look, I wanted it all my life. I finally saved up. I'm ready to do it. You know, and if you know, if they get the clearances, you know, it's definitely a possibility for them.
So does age determine whether, well, breast implants have to be removed at some point, don't they?
No, they have to be surveilled. So that's a common misconception. People think
Okay.
like every 10 years you have to change your implants. So if you have saline implants, you can pretty much put them in and forget about them. Because a saline implant, if it ruptures, you'll know that it ruptured. Your breast will deflate. And then you know you're able to appreciate it without any, you know, diagnostic imaging. With the silicone implant, you have to surveil the implant every 3 to 5 years. You should get an MRI. So let's say you get implants today, and 10 years from now you get an MRI, and it says that your silicone implants are fine. You leave them alone. You can put your implants in today, and 3 years from now get an MRI, and it says that there's like a suspected leak or rupture. Then you should change the device.
So it wouldn't determine, age wouldn't be a factor whether you do an implant or a lift.
Well, I mean, most young women don't require a lift. There are some, you know, congenitally when they develop, they have the ptosis or droopy breast, but that's kind of rare. I think a lift is really part of, you know, a mommy makeover, if you will. A lot of women will have children, and then after they breastfeed, they'll develop, you know, sagging or droopy breasts, and they, you know, they're more of the candidates would be more appropriate for a lift.
Okay. Do you ever go over the muscle with an implant?
I don't. I always go under the muscle. Now there's a, you know, years ago they used to always go over the muscle, and then they had a high problem with capsular contracture, which is where it's a complication you can get where the implant gets hard and it can be painful and, you know, distort the look of the breasts. So then everyone started going under the muscle, and that's the way I was trained, and I believe that's the best way. The incidence of capsular contracture is lower. The appearance of the breast is better. And when you go to feel the breast, you have the skin, the breast parenchyma, the muscle, and then the implant. So if somebody who's really thin and you put it over the muscle, you can see the edges of the implant, the scalloping or rippling.
Oh, I've seen that before. Correct. I don't know what that meant. Okay.
Yeah, so, but nowadays...
That's interesting.
There's a trend where they're putting them, once again, over the muscle, and they're doing a concomitant fat transfer, where they're going to do liposuction somewhere else and then take the fat and mold it around the breast. I don't do fat transfer to the breast because it can create calcifications, and that can obscure your mammography and create other problems. The only downside to going under the muscle is basically it's more painful in the beginning, and initially the implants are too high for some time. And then it takes about 6 weeks for the muscle to relax and the implant to drop. But long term, I believe you get the best results going under the muscle.
Going under the muscle. That's interesting. I've seen that with women's breasts. I just didn't know what it was. So you need a mammo then before you go and
If you're
of age.
So yeah, what happens in my practice is, traditionally women start getting mammography at 40. So if you're 38, 39, I always recommend they should consider it. If you're 40, I will insist that you get a baseline mammogram because I could give you a beautiful set of breasts, and then at 40 you get a mammogram, and they want to do something. They want to surveil your breast. They want to start sticking needles in, doing biopsies and things like that, which could potentially harm your implants. So it's always a good idea. Now, if you have let's say you come to me in your your early 30s, and you have a strong family history of breast cancer and things like that, then we would do a further workup. Probably send you to a breast surgeon, maybe do some genetic counseling, and just make sure, because you don't want to go through the operation and then eventually have a problem later on down the line with, familial, genetic problem with breast cancer and things like that.
Right, yeah. That happened to a cousin of ours. She was young, she had implants, and she had cancer, and they didn't detect it until much later, and it was
the thing I
not a good
see
thing.
more often is a woman will come in for a reduction. And when we're doing a reduction, then we take that tissue that we take off of the breast. It's a hospital rule, and we send it to pathology. And I would
Okay.
say maybe 5 or 6 times in 15 years they inadvertently detected breast cancer.
Wow.
So then that was really a life-saving operation for those patients because they didn't know their mammography was normal, but there was cancer in the tissue. So then
That's
they go and get
interesting.
evaluated and do what they have to do.
Yeah. Do you ever have to do a reduction before you do a lift? I mean, do an implant?
No,
Like if
so
somebody's really big chested.
Yeah,
Like
no,
I would think if you put an implant in, they would be.
yeah, the big thing is an implant. The only reason to put an implant in the breast is to make it larger. So a lot of women come in and they need a lift and they need implants. And a lot of docs will do them at the same time, but I never do them at the same time. I always stage the operations because to do a breast augmentation, you're just really dealing with one small incision under the breast. My incision in the operating room is 4.5 centimeters. And when it heals usually, there's contraction, it heals to around 3 centimeters. So there's really very little concern of scarring with a breast augmentation. A breast lift is a very invasive operation. It involves putting incisions all over your breast, around your areola, down the front of the breast, and sometimes underneath. They call it like an anchor incision.
Okay.
So how do you get a bad scar in plastic surgery? You put tension on an incision. So
Which would be an implant.
No, exactly. So when you do a
Okay.
lift, there's an inherent amount of tension already in the operation lifting the breast up because you're decreasing the amount of skin around the breast mouth. Then if you put an implant in at the same time, you're doubling the tension around those incisions, and the results are suboptimal. And then if you have a problem with your incisions or in the breast lift, then you have to go back and revise them. So it's always better to stage it. If some women come in, they think they need an implant, they have good volume, but it's all down here, you don't need an implant. You just do the lift.
You just do a lift.
You take that volume and put it where it should be, and they do very well. If you don't have to add a device, then you shouldn't because you're just keeping things simple. You get a much more predictable result. But a lot of women need both. So we go and either we put the implant in first and then we wait and see if they need to lift, or we do the lift first and then go back and put the implant in after.
So you're a perfectionist.
You have
And
to be.
I know.
You have
You
to
are.
be.
I mean, even your scar, I've seen scars of
He's got
women in
multiple
plastic-
scars.
But as his mom, I couldn't even tell you what ear. For everyone out there, Joe fixed Chris's ear.
My ear was hanging off my head. So
But somebody else had stitched him first because you were on a cruise. So
Yeah.
you actually had to. That wasn't even just going in raw. You had to fix somebody else's work.
I think the doctor on the boat was a chef on the boat too throughout
Yeah,
the
he
day.
probably
That's
was.
amazing.
Yeah, I don't think he was
Probably
a doctor,
was.
but it is what it is.
That's a story for another time.
But that's talking about Dr. Racanelli's standards. I mean, your standards out of the office also relates to your practice as well, because like you have what I want to say is they mimic each other, your lifestyle and also your practice. So it's like you have the precision of a Ferrari, but you bring that into the OR as well.
You have to.
You have to, yeah, because that's the perfectionist in you.
Yeah, I mean, the point is that, in order to become a plastic surgeon, it takes a very long time. So your
Correct.
entire life is dedicated to that end.
Yep.
So then really, like, when you produce the product, people look at the product. That's your life's work.
Correct.
So if you do bad work, that's
a problem.
That's a big problem.
Big
because
problem.
That's a sign of, I would say it's a career failure.
Yeah. How many botched cases do you deal with in a year, would you say?
The problem with those cases a lot of times is some people are very concerned about price with plastic surgery, so they'll go either out of the country, which I see a lot, or they'll
I hear that a lot.
We've been seeing a lot of it lately too with COVID, or they'll basically go for like a very inexpensive job and then develop a problem, and then they'll come in for a consultation. You'll explain what needs to be done, because oftentimes it costs 3 times as much to fix it, and a lot of people can't afford to fix it.
Yeah.
So then they're even more upset about the problem. But, you know, when the people go out of the country, and look, there's great surgeons everywhere in the world, but if you're going out of the country, you should stay wherever you're going for at least a month, maybe 2. Because what they do is they'll go out of the country, they'll go to the DR, they'll get surgery, and they come back.
Yeah.
And they're not there long enough for problems to manifest. And then they're back here in the States, and then they get a severe infection. You know, they'll basically get very sick. They'll end up in the hospital, and then it's a big problem. I mean, I've seen within the last month, 5 cases, all from the Dominican Republic, all major problems, not little things, major problems.
Do you see the most from the DR?
Yeah, the DR, that's the one place I would not, if you're going to go to like Brazil or Colombia, I think you'll probably be better off. I would not go to the DR at all. I mean, I've seen good work from the DR, but it's just that for whatever reason, and what happens is they recruit people here in the States, especially like Washington Heights had a huge problem, because there's a big Dominican community there. So they would go to the DR, and then it'd end up, because Columbia Presbyterian is there, in the ER at Columbia Presbyterian. It was a big problem for Columbia Presbyterian. So they were putting out like these ad campaigns telling people, don't go to the DR, stay in the United States for your plastic surgery.
But what are you saving? You have to get airfare? You have to stay somewhere? When people say, but I can do it for $3,000.
Yeah, but I'll give you, so for frame of reference, like if you go to like a hospital, and you get surgery in a hospital, you're paying the hospital fees, and then you pay the anesthesia fees for a board-certified anesthesiologist. That's your hospital anesthesia fees before you even get into the procedure, the devices, and things like that. But you can't put a price in your safety. Like, I don't even operate in a surgery center. I only operate in the hospital, because God forbid if you have a problem, and let's say you code on the operating room table. In the hospital, they have a code team. Everyone in the operating room knows how to run a code, and they're there. If you need things, if you need emergency scanning and things, everything is there in the hospital. If you, God forbid, like Joan Rivers died at the surgery center.
I was just going to say Joan Rivers, because
you could be in the best surgery center in the world, okay? You're in a beautiful surgery center. First of all, the people in the surgery center don't know how to run a code, because either they never ran it or they did it 50 years ago. So you don't have a code team there. They're not doing codes every day. The second thing is the emergency equipment might have been used never. Mm-hmm. So now they're going. It's just not the right place to be.
Where did we put this? Where did we put that? It doesn't make sense.
That's why you cannot put a price in your safety. Right. You know, it's penny wise, dollar fool. And
I agree with you.
I see it all the time.
I agree with you. I do too. When people come in, and let me ask, do you ever turn anybody away
all the
because
time.
they had one too many surgeries or?
All the time. The problem with plastic surgery is expectations are critical, and there's a lot of people that have very unrealistic expectations. So when I come in, that's my responsibility, because if I do surgery on a patient and they're unhappy, then I'm miserable.
Right.
Because then I have failed to some degree. So part of my job is being, a psychiatrist, because you have to speak to people and try to get into their head and see it, So if you look at the way I did a consultation when I first came into practice and the way I do a consultation now, it's very different, because I'm very upfront. And, some people don't like that. So one time a woman wrote a review and she said I was brash. And unfortunately, I think it's my personality. I'm very direct, and I take it very seriously. A lot of people will complain, the guy's very serious. This guy's very serious. He's very intense. But
serious stuff.
Yeah, it's serious. It's my life's
serious
work.
Stuff.
But you want that, though. You want a doctor who is stern, straightforward, and that's what I want, at least.
No, but you're very warm about it. You really are. You're not
100%.
I don't know. I can't even imagine somebody saying that.
I want people when they come in to understand, because a lot of times people will come in, they don't diet, they don't exercise. Let's say they're coming in for a tummy tuck, and they want to look like somebody that's unrealistic. Like I can't show up to a doctor's office with a picture of Brad Pitt or like Thor and be like, hey, we're going to do this. It's never going to happen.
Right.
And, some people don't say anything because they want their money, and they take their money and they don't care if the patient's unhappy. I'd rather you not spend any money with me. This way you're not unhappy. And then, you need realistic expectations. So I turn people away all the time.
It's funny. I do the same thing here. I tell people, if you're not ready, people say, why don't you just sell them the food? Because that's not what I'm here for. And in the end, that'll hurt me. It'll come back, right, and I'll be out of business. I'm not here for this.
I've been doing this for years. Injectables is a big thing where patients come in, they'll get a little bit of a result, get very excited, and then some patients don't know when to turn it off. and they keep coming back and back and back. And I tell them, listen, time out.
Yeah.
These are your before pictures. These are your after pictures. And we'll get into that. It's very important. And I said, you have a beautiful result. No more filler. We're not going for this very fake look because, guys will do it because the patients are paying them a lot of money. But then that's your calling card.
That's your work.
You have somebody deformed walking around in his short hose mole. Who's your plastic surgeon?
Yeah. Dr. Racanelli. Can you imagine?
Yeah, I see
you would
it.
never get
no,
that.
I see it all the time. I mean, I have patients come into me upset with work from other people. I'm like, all right, well, do you have any photographs? No, they didn't take any photographs. How could you not take photographs? We photograph everything because photographs are the most objective evidence as to what you've accomplished. And you should do the same. When someone comes in, you should take pictures because you'll have somebody come back and say, I don't see any difference.
Right.
And then you pull the photos up. The problem is it's harder because you're not there with them and, you can give them the best meal plan in the world.
And if they don't follow it, they don't follow it.
It's unbelievable.
Yeah. No, that's true.
But things that get measured get accomplished. So take pictures.
No, definitely.
Yeah.
Yeah, no,
Not even for that, but more for your success stories. Because you know what? People that, some people don't even appreciate the progress that they've made.
Yeah.
And it's amazing because a lot of times, one of the most transformational things that we do, I think one of the things that I do especially is a tummy tuck. Because what happens is a tummy tuck, a woman's body can get destroyed from childbirth and it has nothing to do with their lifestyle. They could diet, they could exercise, but all of a sudden the skin is stretched, the muscles have moved, and that's out of their control.
Right.
So when you do that procedure, you bring them back to the way they were in the beginning, maybe even better. And that's a huge motivator for them. And sometimes you have patients that really weren't taking care of themselves. They didn't diet, didn't exercise. They let themselves go during pregnancy. They had 3 kids. And then you bring them back, and then they start taking it very seriously. They come back, gym, diet, exercise, yoga.
That snowballs. Yes.
Unbelievable. And we have patients like that. They've done testimonials. It's amazing. I mean, I this one lady went to the same gym I did. I used to see her. It was unbelievable, the transformation.
How cool is that? You have a testimonial on your website. I suggest everybody go to the website. You saved someone's life in one of the testimonials. She had a really bad infection.
Oh, yeah.
I cried when I was listening to that woman.
So she had surgery by a very famous plastic surgeon in New Jersey and developed a terrible complication during an abdominoplasty. And he couldn't fix it. And because I do some wound care in the hospital as well. And he's a great guy. And he said, look, do me a favor. Can you take this case over? And I took it over, and she had a lot of complications associated with the original surgery. But we got her through it, and she did great. But what's interesting about that case is that goes to the preoperative evaluation. Because I don't think how they got into trouble in that case was they didn't do the initial workup and they get the appropriate clearances. Some patients get very upset because I send them, if you have high blood pressure, you're going to see your cardiologist. Let's say you've had bariatric surgery. I send you specifically to a nutritionist to evaluate your levels because a lot of patients that have had bariatric surgery have nutritional deficiencies that they're not aware of.
Right.
They're walking around, they feel great, and they don't even know their vitamin D levels and
Everything's
is down.
low. Yeah,
their protein is down. Their albumin is down. So that case in particular kind of molded things. I'm very adamant about getting all these clearances because we have to cross our T's and dot our I's before we go in. Because once you go in the operating room, there's no going back.
There's no going back.
Yeah.
But it sounded like she almost lost her life.
She did. She had a severe infection, necrotizing fasciitis, and then she developed a pulmonary embolism, which is a fatal complication. But she did okay.
Nice.
Yeah.
That's incredible.
What does that feel like? What does that feel like? Because I always say, and he knows, God bless Dr. Racanelli's hands and his mind.
Yeah,
God bless you.
The thing is, when you're in that situation, you have to look at it like I'm very positive. So you have to be. And I told her, I said, look,
You sat on her bed.
Yeah,
She said it.
We're gonna do this because
we're gonna fix you.
when the patient's in the ICU, you can't be like, listen, I'm sorry, we're not gonna make it. You gotta,
Right.
When there's there's no way out, you gotta go deeper in.
Yeah, you got to go deeper. You got to figure something.
No,
Yeah,
but she did well.
Yeah.
She did well, thank God.
Even your Vanity Fair article. Go on. I think it's on your website. The
Yeah, I
Vanity
think
Fair
so.
article.
We'll
The
post it down below, too.
Yeah, we'll post it. The journalist who went to 3 different plastic surgeons,
Yeah.
and she said she wanted to hug you
Well, it's
because
interesting.
of the way you handled her.
I think she thought going in that all plastic surgeons are a particular way. Mm-hmm. And the first 2 were that way, and she ended up in my office. And you know what's interesting is they didn't even ask my permission to print that article. They didn't even tell me
didn't?
about it. No. They just printed it. And then somebody else had pulled it up, and they were like, oh my God, did you see this article? And I was like, no. And then I read it, and I didn't complain because I thought in the end it put me in a pretty good light.
Oh, yeah, she
But
did.
I mean, she was coming in under the notion that every plastic surgeon is just there to, basically push procedures on you and get your money. And I that's never been my practice.
That's why I wanted you here today.
Yeah, no.
That's exactly why I wanted you here today.
Like you said, it will come back to bite you in the end. That was never my goal from inception of the practice, and it's just not the way we do things.
And I like the fact that she asked you if you could show her what she would look like.
Yeah,
and you said it was a very expensive software and it's not realistic.
Well, I saw that in my training, though. So a lot of plastic surgeons use this imaging software, and it's very powerful, especially when it comes to noses, rhinoplasty. So women will come in, they have a big nose, they'll take a picture of them, they'll take a mouse, and they'll make the most beautiful nose in the world. And
that you can't necessarily do in surgery.
100%. And
right?
as soon as they see that, where can I sign? They'll give you whatever they have. So they would do that. And some of the surgeons I train with would give them the picture.
I was just going to ask you, did they give them the actual picture?
100%. And then they would come back after the
they're
surgery.
like this.
Hysterical. I don't look anything like this. So I that's why I don't use that, because it creates unrealistic expectations, especially with a nose, because there's certain things that a nose has function as well. You can't just go and take every nose and make it look a certain way, because if you make certain noses too small, the patient can't breathe. So you have to do, a nose is a very particular thing where it has to have function, which is most important. You have to be able to breathe, and you want it to be aesthetically pleasing.
Right.
And that's different for every patient. And if you do an open rhinoplasty like I do, you have to open the entire nose up, look at what you can cut and not cut safely, make your measurements, and go accordingly. And that's why that software, it's not a good thing.
It's unrealistic.
Very unrealistic.
Can you sue?
So
if it's far off?
This is the thing. I mean, you can sue anybody.
You can sue for anything,
especially in this state. That's not malpractice, but I mean, the problem is, you can sue anybody for anything. It's just that, that's a thing of, I think ethics.
Yeah.
It comes back to, do you want your patients to be happy or not happy? And it's impossible to make everyone happy.
You're not going to make everybody happy.
And from what I do in my line of work, it's a tightrope, because you're trying to make everyone happy all the time. And
you don't want to be stressed. You want to be focused. You don't want to have to worry about this person yelling and screaming.
It's impossible to not be stressed in what I do. So you got to take the mantra, pressure makes a diamond.
Yeah.
So what made you want to be a plastic surgeon? Did you know that going into medicine?
When I was in high school, my mother was basically pushing a little bit. You should really consider doing medicine. And then my brother was a doctor. And then I was kicking it around a little bit. And then people were like kind of laughing at me, because in high school, I had a little bit of rough personality. I was like a very, a jock running around. And some people were like, they kind of put it in my head that I couldn't do it. So once I heard that, I was like, oh, I'm definitely going to do it.
I'm doing it. Right?
So then when I got actually into medical school, and then I was going through the rotations, I looked at the different specialties, and plastic surgery was the only one that really I had a true interest in. I loved surgery, but I really loved plastic surgery. And that was kind of like my main goal at that time.
Yeah. I would. What stresses you out more, surgery or office hours?
No,
different stress.
Different type of stresses. The problem with office, surgery is one thing, and when you're in surgery, you're in the zone. And surgery, I can control my environment somewhat, in a sense that, I always have my music playing. I have my team. I have only certain anesthesiologists I work with, and you have a very nice, environment. Office hours are a little bit more variable, because you have consults coming in and people that you don't know. And you're trying to, you read them, and are they a good candidate? Sometimes people come in, they're not a good candidate, and you want to tell them this in the right way, and then you're explaining things to them very, in a very direct manner, and some people don't like that, and then, so it's a little bit of a tightrope in that regard. But our office hours, we try to keep a very nice environment as well.
No, everybody says that.
Dr. Rack has house music and EDM bumping during surgery.
That's true.
It's like a nightclub.
Listen.
It's awesome.
It's like a nightclub.
Yeah, you gotta get. That's what I like. It relaxes me.
Yeah.
So it's different music for different times, but especially for the surgeries I do are long. A lot of them are big, complicated procedures. So if you're in there for 6 hours, you have to keep a certain cadence or rhythm. So house music is perfect for them.
I was under anesthesia, and the house music was playing. I woke up fist pumping.
Yeah. Exactly.
You were funny when you were going to sleep.
Was I?
Yeah, very.
Oh boy.
Very.
So when we talk about anesthesia, something like a blood clot, could that be prevented if you know somebody's more at risk of having a blood clot?
Yeah.
Or is that kind of, you just give medication and you hope that they don't get it?
No. So, there's two different scenarios that you would have. Some patients anybody can develop a blood clot. But if you came to me and you said, listen, I have, a hematologic disorder, factor 5, things like that, then I would send you to a hematologist and they would evaluate you, and basically they'll guide us and they'll make the recommendations. You're going to take this medication before surgery. You're going to take this medication after surgery. You're going to do that.
Right.
For other patients that have no pre-existing medical history for that, there are things that we do. For a smaller operation, you have what's called Venadynes, which are basically stockings, compressive stockings that massage your legs while you're asleep under general anesthesia. For longer procedures, I give the patient some blood thinner while they're on the table, because the risk of that comes from when you're paralyzed and asleep on the operating room table. If you're not moving around, the blood can pool and you can get a clot.
Okay.
The other big thing with me is a lot of surgeons keep patients in the hospital overnight, and everyone thinks it's great. I want to stay in the hospital overnight. I don't want to go home. All my patients go home because that early ambulation after surgery is critical for preventing a blood clot.
Oh, wow.
If you have a
That's
long
interesting.
operation, 5 or 6 hours, and then when you're ready, you're leaving the recovery room, you're walking to your car, the little bit of ambulation, walking to your house, walking up the steps, that's very important. The other thing is I tell all my patients after surgery, you can't just lay in bed all day.
You got to get up and move.
You have to get up and move around. If you have a big tummy tuck, you're not staying in bed all day and your husband or your family is waiting on you hand and foot. That's the worst thing in the world for you. It's bad for circulation. It's bad for your lungs. So when you wake up in the morning, you're going to go to the kitchen. You have breakfast in the kitchen. You're going to watch TV. You're going to go to the living room and sit down and watch TV. You need to keep moving around.
Keep moving.
That's critical.
Nobody
Yeah.
talks about that.
No,
You never
nobody
hear
does
that.
ever talk about that. They
But-
always say, I get to stay in, or I'm going to the
it's a
hotel in New York and staying.
Terrible idea.
Yeah.
Because basically you
interesting.
need to move around, because it's funny, I did a couple really big procedures combined with general surgery in the past, and the general surgeons demanded the patient stay in the hospital. And then one of those patients I saw, they developed a blood clot. Thank God they were fine, but they just laid in the hospital bed all night. The nurses waited on them hand and foot. So
They
if
didn't
there's
move.
ever a situation where a patient has to stay in the hospital overnight for whatever reason, then I give them blood thinners while they're there. But for some procedures, you don't want to really give patients blood thinners because it increases the chance of getting a postoperative hematoma or a seroma, things like that.
Okay. Yeah. No, that's interesting. I never thought. I figured you would. Do you tell them to get lymphatic massages after a tummy tuck?
Yeah, so I wasn't a real big believer of them in the past, but lately I've been working with this one woman in particular, and she's achieved amazing results. I mean, I've never seen anything like it. We have a couple lymphatic drainage masseuses that we work with, because basically they're independent contractors, and we refer them to different people, and one lady's at a much higher price point than the others. But I mean, what I've seen her do with my patients it blows me away. And I posted a lot of my stories because, I mean, she has patients looking amazing in 8 days after Vaser 360. I mean, very invasive liposuction where patients would normally be swollen for 8 weeks. And she has them looking great in 8 days.
That's amazing.
And there's proprietary techniques that she uses, and then she uses the kinesio tape. And I mean, she does a really good job. So lymphatic drainage is not mandatory. A lot of people don't believe in it or can't afford the sessions after the surgery, which is fine. You can still get a good result. But if you're trying to look as best as you possibly can, as soon as you possibly can, lymphatic drainage is an excellent option for really tummy tucks and liposuction.
Yeah, I know one of my clients, somebody that I know had a tummy tuck. She couldn't even straighten up for weeks.
Yeah, that's normal though, because depending how tight you are pulled, a lot of patients will walk hunched over for at least the first 2 weeks. And when they sleep, they don't sleep lying completely flat. They'll either sleep in a recliner, or they'll buy these big foam wedges that go behind their back and under their knees to put you in what's called the beach chair position. And that takes tension off of the incision.
Okay. All right.
Does your advertisement fly around too on that beach chair?
Do you need to be close to goal weight to have a tummy tuck
So,
and/or lipo?
great, excellent question. I never tell patients to diet for a procedure ever, because people, as you know, yo-yo diet all the time. They're up, they're down, and a lot of times when people do diet specifically for a procedure, they'll do some very unhealthy dieting that puts them at risk.
At risk.
They'll take diet pills
sense.
and have other problems.
Yeah.
So I tell any patient, I ask them when they came in, what's your weight now? Then in the last 5 years, what's the heaviest you've been and what's the lightest you've been? And then we get an idea of where they what's their baseline weight. And really, I want to operate on you at your baseline weight, because if you stay at that weight, we're perfect. If you lose more weight after the procedure, it's even better. But if I operate on you at a falsely low weight and then you balloon up to a different weight, you're gonna affect the results, the aesthetic and cosmetic results of the procedure. You're not gonna look as good as you can.
Okay.
So I tell patients this all the time. I mean, I tell everyone, you need to diet and exercise. And it's not like a temporary thing. Some people diet and exercise temporarily.
You can't.
You have to diet and
just do it.
exercise for the rest of your life. You
Right.
get your hair cut for the rest of your life. You get your nails done for the rest of your life. Diet and exercise is part of that. But a lot of people don't diet and exercise, and that's fine too. Some people just don't. But then for those patients, they have to we have to make sure it's medically safe to do the procedure. But B, we have to make sure that they have realistic
Yeah, they have to be
expectations
realistic.
as to what happens. Another pitfall with plastic surgery is patients will come in they don't diet, they don't exercise. They're not the best candidate, but they can still benefit from an abdominoplasty or a tummy tuck. And they'll say, listen, I don't care. I just want to get rid of this that's just hanging out of my jeans. Once I get rid of this, that's all I care about. And you say, no problem. And then what they do is they move the goalpost. So you do the surgery on them. They look amazing compared to the way they looked. Then they come back and they say, this could be better. And you're like, yeah, it could always be better. But then you have to go back to them and you have to look at the photos and say, well, this is what you started with. And this is where you are now. Now, if you're not dieting and exercising, what are you going to do with this now? You might need more procedures to go to the next step.
Okay. How about liposuction? Because I always see women who lose a lot of weight and they always say they just wish they can lipo their stomach area. And sometimes they'll show me, but I mean, I could be completely wrong, but skin is skin.
100%.
Right? So if you lipo and the skin is there,
you're very knowledgeable about plastic surgery. I'm very impressed.
Thank you.
This is amazing.
But it kind of makes sense to me, right?
This is a PSA, public service announcement. So liposuction does one and only one thing. It removes fat. Liposuction does nothing for your skin. So women come to me all the time that are actually not that heavy, but they've had kids, and they want the front of their abdomen lipo. And a lot of plastic surgeons will do it, and I won't. And they get mad about it. They say, look, I don't want that incision from the tummy tuck. I said, fine, then leave the front of your belly alone. And the reason is lipo only takes the fat out. It does nothing for the skin. When a woman gets pregnant and the fetus stretches, the skin stretches, and it loses its elasticity.
Yeah.
So now you have skin that's not good skin to work with because it doesn't have the elasticity. Because normally, if a woman doesn't have a child, when you suck the fat out of the front of their abdomen, the skin sucks back down because it has good elasticity. Once you have a child, the elasticity is not good. The second problem is the muscles.
See what you do? You guys do?
That's true.
Oh, my God.
The muscles separate with pregnancy, and they never go back. It's called erectus diastasis. That's why a woman's abdomen is always more lax after pregnancy than it is before. Mm-hmm. Liposuction can't fix that. So women that come in, let's say they have 1 or 2 kids, and they're very thin, they want the front of their abdomen lipo. They're expecting their abdomen to be flat and tight. Lipo will not do that. Only a tummy tuck will do that. Because with a tummy tuck, you're tightening the muscles. So you're putting the muscles back to the way they were before pregnancy, maybe even better than they were. And in a tummy tuck, you're cutting the excess skin off and pulling it down. So yeah, liposuction is great. The best candidate for liposuction is somebody who diets and exercises that can't get specific areas of fat off their body. So
small, like 10, it doesn't really matter.
It doesn't matter about your weight. So I see all the time, women will come in, they work out, they diet, they exercise, and they have love handles.
Right. I
have love handles. I diet and exercise, so that's the perfect candidate because they can't get those particular target areas. Saddlebags around the lateral thighs is another area. Mm-hmm. So certain spot areas, those are the best candidates for liposuction. Diet and exercise, areas where they can't get the fat off. Because you'll see, UFC fighters, guys that drop major weight and they're still storing fat in certain areas because your body's genetically predisposed to store that fat in that area. And it's very unlikely you're going to get rid of that fat, even with severe dieting and exercising, because it's just not realistic.
So when you have lipo, does your fat go somewhere else if you gain the weight?
So good question. You're born with a finite number of fat cells. So let's say for all intents and purposes, you have 100 fat cells. When you receive liposuction, those fat cells are removed. They're permanently gone. So let's say you get lipo and you gain 200 pounds after getting liposuction. You're going to gain fat everywhere else in your body first. So if you lipo your abdomen and your flanks and then you gain a lot of weight, you might gain weight in your face, in your arms, in your breasts, in your thighs, and your butt. But if you gain a massive amount of weight, you also gain some fat in the area where you had the liposuction. Okay. Whatever fat cells were left behind, they'll grow, but they'll grow disproportionately to the other areas. So that's a common misconception. People are like, oh, I had lipo, now I'm getting fatter elsewhere.
You're right, I'm distorted.
Yeah,
you hear that all the time.
Because the problem is, and I see this all the time. Some people get lipo serially. They get to a certain weight, they go somewhere, they get total body lipo, then a couple years later they do it again and do it again. The problem with that is because they're not changing their lifestyle. Whatever your lifestyle was that made you gain the weight, if you get liposuction, it's not it doesn't fix that.
I say it all the time, but this is not a vaccine against weight gain.
Correct.
It's just not.
It isn't.
Yeah. Okay. A lot of people think that. They think that they're going to get very distorted.
Plastic surgery, people come in all the time. How much am I going to weigh after the procedure? I tell them, look, you might weigh the same. Plastic surgery is to change your shape, your contour. It's not for you to lose weight. If you want to lose weight, that's bariatric surgery.
Right.
And I don't recommend that either, because I have a very good friend who's a very prominent bariatric surgeon. And what I see is a lot of these patients gain the weight back. With major invasive procedures, they find time, over time, they'll stretch the anastomosis, their stomach will stretch, and they end up gaining a lot of the weight back after they had and bariatric surgery can be dangerous, can be life-threatening.
I have a lot of clients that had surgery before, and they went right back up, and now they're doing ideal.
Because the key with that is you have to diet and exercise.
Right. They didn't learn anything.
No, of course not. And it's an easy fix.
Right.
Diet and exercise is hard.
Right.
Nobody wants to get up in the gym or go, I work, I don't have time. Yeah, it's the truth, but you have to make time. So then they don't do that. They go to a surgeon. They don't really, their insurance pays for it. They get the procedure done, and some of them will lose weight initially. But all those lifestyle changes that weren't made will catch back up with them, and then they gain the weight back.
And to me, some of them don't even look healthy when they lose the weight because they're not getting adequate protein. They're
100%. That's why
they've aged everything.
A lot of times, major weight loss patients from bariatric surgery need body contouring. So they'll come to see me. And then that's why, I do it. I don't do a lot of it because I don't participate with insurance. A lot of them want to put it through an insurance plan. But when they do come to me and they are going to do it, we do the extensive clearances, especially the nutritional evaluation. I have one particular doctor, that's what she specializes in, and she will go and do a full workup. And then sometimes she has to get them ready for surgery for 2 months on supplements.
Yeah. No, I see that a lot. I really do.
Sure.
If I had to ask you one procedure a woman could do to look younger, what would that be?
Okay.
On the face.
It's a loaded question.
Is that a loaded question?
Yeah.
On the face.
So I think one of the easiest things you could do is Botox.
Okay.
So Botox is one of the simplest things to do. It can be done in under 10 minutes, and you can really get like a surgical result, like a forehead lift, just doing Botox. The other good thing about Botox is one of the things you can do that's preventative. So somebody can come in, let's say in their 20s, and have no wrinkles on their forehead at all, and start using Botox, and if that muscle can't move, they're never going to make those creases, and they're not going to develop the wrinkles.
That was my next question.
Yeah, so Botox.
A lot of people think that.
Yeah, Botox is the one thing that you can actually use prophylactically.
Okay.
And the only downside to Botox is it doesn't last very long. It lasts on average 4 months. I've been using Botox for 15 years. I get around 3 months out of my Botox. So some people, if it doesn't last long, they get upset. And they say, oh, the Botox doesn't last long. And you can't, as a physician, you buy the Botox and then you inject it. But the thing with Botox is you need to do regular application. And most people that do Botox use it incorrectly. They'll apply it, and then they'll let it wear off completely. Then they'll go back and do it again and let it wear off completely. And then your muscle has memory. So whatever,
it'll go back.
You go back.
Yeah, okay.
My patients come and do Botox every 4 months, like clockwork. And then what happens is after 2 or 3 treatments, that muscle really starts to atrophy or weaken, and the results are much, much better. So the second or third treatment serially is much better than the initial results of the first. And what I do, every patient that I see for any filler injection, they have to come back and see me in 2 weeks. So when you come back and see me, I pull your pictures up. The pictures never lie. It's the most objective way to do any aesthetic treatment, because you come back and you can say, okay, because people will say, oh, I want to see what it looks like. And then sometimes you might need a little bit more Botox, and you would get it at that 2-week follow-up just to make little tweaks.
The little tweaks. Okay.
Some people inject people and they never see them, and they don't even know what they look like.
I've seen some scary.
Exactly.
Some very, very scary. Yeah, like you almost go, ooh, like out loud. Yeah, it's bad. How about the silicone that they put under, I've heard people get it under their eyes or in their lips.
Yeah, so that's not FDA approved, so I never do that at all. There are some doctors in and around New Jersey, New York that do it. The problem with that is it's dangerous because your body doesn't like loose silicone floating around in it. So a silicone implant is very different. In the silicone implant, you have silicone gel that's surrounded by a silicone elastomer shell.
Yeah. Okay.
But when they're injecting free silicone in and around your face, I've seen some results where it looks amazing, looks like surgery was done. But the problem is if your body develops a reaction to the silicone, which I've seen a lot, then you can permanently disfigure your face. And then you need surgery to go in and try to scrape that silicone out because it creates like an allergic reaction. So I have a patient of mine who was a very pretty girl. She was doing a lot of modeling, and she was very thin. And she was with another group of models she was living with at the time, and they went to some hotel room and had illegal silicone injections in their buttocks because they didn't have any fat to do a fat transfer. And 4 of her friends did perfectly fine. And then she went, and then she ended up very sick in the intensive care unit in the hospital. We did 6 or 7 surgeries on her to clean everything out, and then we had to basically reconstruct her. And she looks good today, but you know it's just not worth it. So I wouldn't put free silicone anywhere in my body, but especially not my face, because I mean at least with her buttocks she can wear pants and cover the area.
Right.
If you develop an allergic reaction to silicone in your face, you're in trouble. You're a big problem.
6 to 7 surgeries.
Oh yeah.
Wow. Back-to-back days.
No, usually what happens is you go like if they're very sick and you have to do serial debridement, you have to keep cleaning away the dead tissue and scraping the silicone out. It's usually every 3 or 4 days for a while.
Wow.
Going back to the OR, it's a lot.
Yeah. And Mom, I'm very impressed. You have some great questions.
Thank you.
I think you were a doctor in your past life.
She knows a lot about plastic surgery.
She does. What do you like? Read books about plastic surgery or?
No, listen. Some of my clients, we told that Dr. Racanelli was going to be on. They wanted questions asked. Sometimes they do when they come in here. They'll show me like, what do you think? I mean, I'm not a doctor. I don't know, but that's when I go see Dr. Racanelli.
Yeah. So as we're concluding, my one question is, you have a ton of experience. You started how long ago now?
15 years ago.
15 years ago. Was there any mentors to you coming up that really showed you the way of plastic surgery that you looked up to?
It's interesting, and it's a tough question because plastic surgeons, there's a saying, they don't play well together in the sandbox.
Interesting.
So, like my brother, and I'll give you, this is a good analogy or a good juxtaposition, if you will. When my brother first came into practice, he was a young psychiatrist, and these other surgeons, these older Italian doctors, this was in a small hospital in Saddlebrook, like took him under their wing. They let him use the office space. They helped him out. They sent him patients, and they didn't feel threatened by him at all. And there was another psychiatrist in Morristown that took him in that was basically teaching him what to do. And he had a very nice relationship. Plastic surgery is the exact opposite. So as soon as you show up as a young plastic surgeon and you show up at a hospital, they're trying to keep you out of the hospital. Yeah. They're trying to block you from operating. They're trying to basically, they automatically feel threatened that you're going to come and take their business away. So yeah, the mentors that I had, I mean, when I was training in Philadelphia, and I keep in touch with a lot of these guys, you learn a lot from them and you see a lot. But unfortunately, it's a lonely road. You have to kind of, forge your own path, and then interact with people. So I mean, there's some older plastic surgeons that I have a good relationship with, but unfortunately, I didn't have the same experience that my brother had, where guys would come and take you in and try to. The one doctor that is not in my specialty that was very nice and helped me out tremendously was Dr. Summers. Mm-hmm. Because when I initially worked for another plastic surgeon for a small period of time, and then basically we decided that it wasn't working out. So on one day I found myself, back in my parents' house with no office, no money, and nowhere to go. And Dr. Summers was very nice to me, and she basically gave me a room in the back of her office
and helped you
and helped me out.
Yeah.
And didn't take any rent and said, listen, let me help. And she sent me some patients, and to this day we have a great relationship.
Yeah.
She was like probably one of the nicest physicians to me that I ever had.
Yeah.
And it's funny because there's nothing I could do for Dr. Summers. It wasn't like she was already well established and had her cult following, book of business. I mean, she has patients that.
I'm sure you pay it forward.
Yeah,
you
course.
Pay it forward.
Of course,
I know you. Yeah.
But that's kind of unfortunately, I wish I could give you, so and so took me under their wing and taught me everything.
It's
but
different.
It's not that way. I mean,
they're probably looking to you now.
Look, it's amazing. I mean, I try to help people as much as you can.
Because the learning curve, just sitting here listening, there's so much stuff you have to know.
Oh, there's no question.
So much.
You
stuff.
just have you have a talent. You have a talent. God bless you. God bless you. I say it all the time.
God bless Joe's hands.
God bless him. And this is what I want to do here is bring the best of the best.
Sure.
And you're the best of the best.
No, thank you very much.
You're the best of the best.
Yeah.
Before we finish, though, I have to ask you, Kybella is the injection, the fat injection.
Correct.
Sonobella, is that just lipo?
Sonobello is a company that does, they call it like a doc in the box.
Sounds like a bottle of wine.
Doc in the box.
So what happens is a lot of doctors don't want the trouble of running their own medical practices because it's hard to run your own medical practice. And believe me, I started mine from scratch and I didn't have any help.
Yeah.
My dad wasn't a doctor, so I didn't know.
He wasn't?
So Sonobello is a company that hires young plastic surgeons or even older plastic surgeons that don't want to run a practice, and they run the practice. They'll market the practice. They advertise. That's why you know the name.
Mm-hmm.
So they market
Yeah.
the radio, TV ads. Then they'll sometimes they have coordinators or young people that'll come in and basically greet and meet the patients and teach them. They're often not even physicians. Teach them about the procedures and trying to get them to sign up. And then when they sign for the surgery, a doc will show up, do the operation, and that's it.
Crazy.
It's very common. I have guys that were trained underneath me. It's very common in LA and in Florida. So I have guys that when they first came out, they were trying to build their practices, but they didn't have a book of business, as you would say. So they would go and basically do an operation and get only 30% of the proceeds of the operation. And the 70% went to the people that ran it.
Advertising and the people that ran it.
Exactly.
Yeah.
So there's a lot of non-physicians that run medical practices, and they actually do very well. Because a lot of doctors are not good business people. I mean, they don't teach you anything about business in medical school, and there's so many other things going on. And nowadays, the trend is a lot of the solo practitioners are wayward now. They're gone. All the practices are being bought up by the hospital systems.
Right.
So most of the physicians now are employees.
Yeah.
And the problem with that is that's going to impact the care going forward because you're not going to get that personalized care because they're on the 9 to 5 and they're out and it is what it is.
So is that like a lunchtime lipo? Is that the same? What is that lunch? That's like such a buzzword.
Yeah. So that's a different thing. I mean, that's basically liposuction in a physician's office under straight local anesthesia. So when it's funny, when Smart Lipo came out, which is laser liposuction, and this is back in the 90s, early 2000, they were pushing it on everybody. So the guy came to my office. He said, "This is the latest and greatest technology. It's laser liposuction," and everyone loves the term laser. When people hear laser, they get excited.
I don't like laser. That's fire. I don't like it. I don't. When I hear that, I go, laser. Don't put laser anywhere near me.
So I said to the guy, I said, "Okay, I want to try the machine, see how well it works, and then I'll decide." And he goes, "No, you can't try the machine. We don't let anyone try it." He goes, "Britney Spears had this done. That was what they were using to market it." I said, "Well, if I can't try it, then I have no interest in it." He goes, "But what I'll let you do is you can go see the world's expert on Smart Lipo do it." This was a dermatologist in Manhattan. It wasn't even a plastic surgeon, it was a dermatologist. I said, "Okay." So I go to the guy's, he has a very big med spa in Manhattan, famous med spa. I go there and I see him, and a guy was in there, and he puts the guy on the table. He gives him some local anesthesia to numb him, and he starts doing liposuction on it. The guy's jumping around on the table like a fish because, some areas he doesn't feel it, other areas he feels it. I saw he did basically he got out about 25% of fat that I would normally get out in just doing traditional regular liposuction, and the results were terrible. And then I knew it. So lunchtime lipo sounds great. You do not want to be awake during liposuction because if you let's say you have discomfort, which you're going to, then the doctor has two options. They can stop doing lipo because they're being humane and don't want you to suffer. Then you're going to get a crappy result. Or they can continue lipoing to try to give you a good result, and you're going to be traumatized because you're awake getting jabbed with a cannula.
Yeah, that's crazy.
You want to be, trust me, if you see the stories, and I know he follows, my page, you want to be 100% asleep during liposuction. You don't want to feel anything. You want to be comfortable, and you want to let the surgeon do what they have to do.
Yeah, there's no reason why you would be awake.
There's so much marketing in plastic surgery. It's always buyer beware. If a lot of these medical tech, look at Cool Sculpt.
I was just about to ask you, Cool Sculpt, M Sculpt, what is that?
All right, Cool Sculpt, I never believed in. It's this fat freezing device, and basically now.
And I heard it hurts.
Not only does it hurt, the thing why I never did it was because I looked at the results, and the results I would never feel proud to show anybody. I was never impressed by the results. Now, Linda Evangelista.
I was going to ask about her. She's suing them.
Because she had this complication, it's called PAH, where basically the area that you treat where you're trying to get less fat, you get more fat. The ice cold, from the device stimulates your body to grow more fat. So now you paid them to lose fat, and you got fatter from the procedure.
So then they go back again.
Yeah,
no,
then you have to get liposuction. No, it's not cheap.
But I don't know. People say they need 3-4 treatments.
Yeah.
So I said, how much is it? And they told me. I said,
You're better
a
off
tummy
getting
tuck.
you're better off getting regular liposuction.
Or get the tummy tuck.
Yeah.
It's going on the abdomen.
Too
That
many-
makes no sense.
Too many marketing problems in
Okay, so
plastic
that-
surgery.
Saving
Yeah.
money
Is that the
costs you a
same as
fortune.
M-Sculpt?
M-Sculpt is different. That's a machine that basically stimulates the muscles. It's supposed to give you like a big booty, if you will. I think it's another fad. I mean, if you want a big butt or big quads, you got to squat, go to the gym, work out. Maybe do a fat transfer. I see people with this M-Sculpt thing. It's another scam. I don't believe in it. That's the thing. There's a lot of things, like a lot of laser treatments to give very suboptimal results, and I don't do them.
Right.
Because, like I said, everything has your name on it. And these machines are good, though, because for some docs, they're very good at getting the latest machine when it has a huge buzz, and they can make a lot of money initially. And then the problem is they don't care if they end up with, could you imagine the first guy that had CoolSculpt? I'm sure he made a fortune.
Yeah.
But then
Yeah,
now, how many patients do you know that are really happy with their CoolSculpt results?
I've heard of people going for an evaluation and never going through with it.
Yeah, it's a scam.
So do these companies just make these devices and then just exit the company once it's at their peak?
No, what's interesting is Allergan, which is a huge aesthetic company, usually buys some of these devices,
Yeah.
takes them under their wing, markets them like crazy, and then I think they just kind of fall off.
Yeah.
But it's like anything else. I mean, buyer beware. You got to do your research, and you got to
Yeah.
really look at the photographs. I look at the photographs for some of these devices, and you can see the photography is a joke. They're like one
Photoshopped.
Yeah, it's not even. It's either photoshopped or from different angles. It's
Yeah.
just. It's not. It's just not worth it, because if someone comes to me to do anything, they're taking their hard-earned money and they're trusting me to do the procedure.
Yeah.
So that's important to me, because a lot of my patients are not hyper wealthy people. They're basically hardworking people that could take that money and put somewhere else.
Yeah.
So now they're coming to you. You got to make sure you give them at least what they expect. Hopefully more than they expect.
And you
So-
always deliver.
Well, with these devices, that's why I would never do it.
Yeah.
Years
Because
ago,
it seems like with plastic surgery, if you try to save $1, it costs you a fortune.
you can't go
fact.
by cost. You
Yeah.
really can't. It'll cost you
You'll
triple.
get what you pay for.
You get what you pay for. Years ago, I don't know if you came with us to a doctor's office. There was a machine that literally, there was a wand that went over your body.
Oh, yeah.
And I think the
Was this
person
the
had their
Zerona?
clothes on.
Yeah.
I don't remember the name.
There was like a thing. It looked like heat lamps, and it was supposed to be like
it's
a thing.
fun.
Yeah,
And then but they were like, look at the results. And I'm going, what results?
Yeah.
Nothing.
It's crazy.
Nothing. And people were buying in and they were signing up.
of course.
And I think they signed up 15 people that night.
That just
believe
goes to
it. I
show
was
you
laughing.
that the best product doesn't always win. A lot of shitty products come through and they win.
Yeah, of course.
Yeah,
But
that's
you know
like
what? A
anything.
lot of people don't do their due diligence. You'd be
Yeah.
surprised.
People are too lazy to read about something or
How many people take the calls for the auto warranty?
Yeah.
And then give them all their
yeah,
information. on the phone?
exactly.
That's
exactly.
true.
You'd be surprised.
This
Exactly.
is PSC&G, and you need to pay your bill before we shut you off, and they do. And your bill all of a
Exactly.
sudden was $4,000.
Exactly.
Nobody questions it. Yeah, no, it's true. Well, would you come back and do another one
Oh,
with us?
100%. This was
Yeah.
great. Absolutely.
This
Fun,
was awesome.
right? It's-
Thank you
it's
very
great.
much
Yeah,
for
of
inviting
course,
me.
of
I'm
course.
shocked how much you know about plastic surgery.
Yeah, me too.
No, I mean,
crazy.
listen, I think all women do. We kind of,
Do you have trainers and fitness people that you work with?
we do. Well, we just had a Navy SEAL on our last podcast,
Yeah.
and he's a trainer in Verona.
Yeah.
He's my trainer. He's
He's
very,
actually
very
great.
good. Yeah.
One thing I would do, especially for what you're doing, because I do it a lot. Like I have some trainers that I know in the area, and I when patients come in and they're serious about it, I say, look, go see this guy. I have his card in my office. I give it out.
Right.
He does a great job, and it's funny because then you can tell some of the patients go and see him and they do 1 or 2 sessions and they never go back.
Yeah, and they stop.
And then you have the others that are like, oh, they've been there for 2 or 3 years,
Yeah,
But that's an adjunct, and it would only help you with what you do.
Absolutely.
Because it's all part and parcel. The diet's important, but the training is important. And one of the trainers I had, she moved away, but one of her famous lines were, "Abs are made in the kitchen."
Yeah.
Abs are absolutely made in the kitchen.
Because some people, they go and they train, but they eat like animals,
Right.
And they're not eating the right
You
things.
can't out-train a bad diet.
No,
You just
You
can't.
can't. That's a
Yeah.
fact.
No, it's true. And
a
then I
fact.
also believe that you do need help.
Yeah,
Everybody
of
needs
course.
help when it comes to dieting. It's very hard to
Coaching
be
matters.
self-disciplined. Coaching matters. That's my motto. Coaching matters.
Not only that, accountability.
Yep.
Because if someone has to come back to you and see you,
Right.
and then they're going to evaluate the results, they're going to think twice about it than if they just buy a plan and never go back. And
Exactly.
the coaching is important.
They believe in the lies that they tell them. We all say it to ourselves, right? We
listen,
all do it.
we're
So
Italian, so
human. We
Yeah,
are Italian.
exactly. Exactly.
Yeah, it's tough.
It is.
It's very tough. So, Dr. Racanelli, thank you so much for joining us and coming in. I really appreciate it, and hopefully we can do it again soon.
Thanks for inviting me.
Awesome.
We had a
Thank you.
Great
Thank you.
conversation.
Yes, thank you.
Definitely did.
Definitely.
Thanks.
Thank you.